Hello, welcome to the fourth med course. In this video, we'll be discussing important aspects of hepatocellular carcinoma, which is also called primary liver cell carcinoma, PLCC. Hepatocellular carcinoma, they are malignant tumors of liver parenchymal cells. They are also called primary liver cell cancer, as stated earlier. And this means that these cancers arise from the cells of the liver as against cancers that metastasize from other sites. It is the fifth most common cancer in the world, and it is the third most common cause of cancer death. These are the epidemiology. Of important note is that up to 60% of patients with hepatocellular cancer in Nigeria are hepatitis B surface antigen positive. So hepatitis B is an important cause of liver cancer. The risk factors for hepatocellular carcinoma are chronic viral hepatitis, that is hepatitis C or hepatitis B, chronic alcohol consumption, exposure to aflatoxins, which are fungal toxins commonly associated with poorly stored grains, thorough thrust, which is an X-ray contrast, vinyl chloride, schistosomiasis in chronic cases, although very rare, liver flux, iron deposits, and tobacco smoke. In discussing how hepatocellular carcinoma or PLCC arise, the pathophysiology has not been definitively elucidated, and it is clearly a multifactorial event with several factors coming together. However, in development, there is a role played by inflammation, necrosis, fibrosis, and ongoing regeneration, which first leads to cirrhosis of the liver before development of hepatocellular carcinoma. In patients with hepatitis B virus, hepatocellular carcinoma can develop in livers that are not cirrhotic. That is, without cirrhosis, there can still be development of hepatocellular carcinoma. However, in people with hepatitis C virus infection, which have not been well treated, they must first progress through cirrhosis before having hepatocellular carcinoma. The cause for hepatitis B causing hepatocellular carcinoma directly before having cirrhosis might be due to the fact that hepatitis B is a DNA virus which can directly incorporate into the genome of the host and causing mutation. Other factors that have been found to play a role include external and environmental factors that can lead to genetic change. So essentially, it is a combination of external environmental factors and genetic factor. This picture shows the pathways by which hepatocellular carcinoma as a final pathway occur from viral hepatitis, which can cause chronic liver disease, which may cause cirrhosis, then lead to hepatocellular carcinoma. However, it can also come through the non-cirrhotic pathway to just progress directly. Other things include aflatoxins and hormones and genetic and environmental factors. Clinical features include features of cirrhosis and stigmata of chronic liver disease. The stigmata of chronic liver disease are discussed in details under the slide of chronic liver disease. Other things that can present, other features of hepatocellular carcinoma include abdominal swelling, hard nodular tender hepatomegaly, weight loss, which is often marked, jaundice, abdominal swelling, right upper quadrant abdominal pain, and hepatic bile. Also, paraneoplastic syndromes may be associated with hepatocellular carcinoma. In most patients with hepatocellular carcinoma, a triad of right upper quadrant pain of the abdomen, abdominal swelling, and jaundice are usually present. Some of the paraneoplastic syndromes that might occur with hepatocellular carcinoma are listed here. Hepatocellular carcinoma may be associated with hypoglycemia, thrombophlebitis migrans, erythrocytosis, neuropathy, sexual changes, gynecomastia, and others listed here. The investigations that can be done used mainly for screening, or investigations that can clinch the diagnosis, or other investigations that can help to detect extent of disease or spread. The screening investigations include testing for the alpha-fetoprotein, or doing a serial ultrasound or a CT scan to know if the patient have features of cirrhosis. The test that can form definitive diagnosis is mainly histological, that is, by taking biopsy for histology examination or a fine needle aspiration cytology. The tests that can help to confirm the extent of disease and the fitness of patient for surgeries can also be done. Alpha-fetoprotein levels greater than 400 nanograms per ml is usually considered diagnostic for hepatocellular carcinoma.